Individuals with esophageal atresia, or EA, have lifelong increased risk for complications of the esophagus, such as stricture, esophagitis, Barrett's esophagus, and esophageal cancers in adulthood. According to published EA guidelines, surveillance endoscopy should be performed at several points during childhood to screen for these problems so we can intervene early. However, the actual usefulness of a surveillance endoscopy and the ideal timing of endoscopies has been critically underexplored in pediatric EA. In this study, we hypothesized that surveillance endoscopy in pediatric EA has high clinical utility, even in the absence of symptoms. We reviewed the records of all our EA patients who had at least one surveillance endoscopy at our International EA Referral Center over a nearly 20-year period, with the goal of identifying how often endoscopies were useful. That is, how often the findings on an endoscopy led to an escalation in medical or surgical management for the patient. We found that in the nearly 1,500 surveillance endoscopies performed for over 500 unique EA patients at our center, over half of endoscopies had actionable findings that changed the management of the patient. Nearly 3/4 of all patients had at least one actionable endoscopic finding at some point in their follow-up. Importantly, symptoms generally did not predict presence or absence of common actionable findings like reflux inflammation on endoscopy. We found there is potential benefit of surveillance endoscopy across all types of EA patients in this study, but that children with certain features such as long gap esophageal atresia or hiatal hernia were at increased risk for discovery of issues. Our statistical analysis predicted occurrence of an actionable finding every 5 years for any given patient in our study. Based on our data, we propose a pediatric surveillance endoscopy algorithm suggesting a child be screened at least every 5 years, with certain high-risk groups like long gap atresia scoped more often. This work is currently the largest pediatric study of surveillance endoscopy reported and examines a wider array of actionable endoscopic pathology than what has been studied and reported before. Future prospective collaborative efforts between centers will help refine optimal surveillance practices.